Hi, my name is Kayla, and I am a student in the BSN program at Florida State College at Jacksonville. I am also a registered nurse on a neuroscience unit at a local hospital. The point of this video is to share my knowledge on stroke and stroke education for our patients, and hopefully at the end remind my fellow nurses that this is education that we need to be providing to all of our patients, regardless if they are a stroke patient or not. So we're just going to start with some basic stroke facts. 1. Every year, more than 795,000 people in the United States have a stroke. 610,000 of those, it's a first-time stroke. The remaining 185,000 is a repeat occurrence. 2. Strokes kill almost 130,000 Americans every year. 3. About 87% of strokes are ischemic strokes. The remaining 13% are hemorrhagic strokes. 4. Strokes are more likely to occur in males, however, females are more likely to die from them. And 5. Risk of stroke is highest in African Americans. So next we're just going to briefly cover the different types of strokes. First up is ischemic stroke, the more common one, remember 87%. So an ischemic stroke is when a clot, usually a fatty plaque deposit, is traveling in a blood vessel leading to or inside the brain, and it ends up clogging that blood vessel. When that happens, the brain can't get the blood and oxygen that it needs, so then those brain cells start to die. The other main type is a hemorrhagic stroke. A hemorrhagic stroke is when a blood vessel is weakened and it ends up rupturing. So then that blood leaks out into the surrounding brain tissue, and once again, the brain cells start to die. Another important part that we need to discuss is TIAs. I'm amazed at how many people do not know about this. TIAs are transient ischemic attacks. They are transient, but they are ischemic. So basically what happens is that clot doesn't stay there. It ends up breaking free and it keeps on going. So the symptoms that the person feels, they end up going away. So this is the biggest reason why it is important to discuss with your patients. People think, okay, the symptoms went away, I'm okay, I don't need to worry about it, it's fine. It's wrong. Usually they are a precursor to a stroke in the future, so they need to seek medical attention immediately. So next up, we're just going to cover the symptoms of a stroke. I'm sure you've all heard of the acronym FAST. We're just going to go over it very briefly. I figure it's the best way to remind people what the symptoms of a stroke are. So FAST. F stands for face. You want to look at their face, see if one side is drooping. A is for arm. Ask the patient to raise both arms up into the air. See if they can raise both arms, or if one arm's weaker, or if one arm just starts to drift off to the side or down. And S stands for speech. Ask the person to talk. Is it slurred? Are they not able to talk, etc.? And T is for time. Time to get that person to the hospital. So next we're going to discuss what to expect if you get a stroke alert. So once a person arrives into an emergency department, they're going to get a CT scan. They need to be seen by a neurological doctor who's going to determine whether or not they are a candidate for TPA. Once they arrive on the unit, whether it's a confirmed stroke or not, there are certain orders that you can expect. So first, you're probably going to expect an MRI. So be ready to do an MRI screening. Also, because of the MRI, you need to make sure that your patient has an IV in their arm above their wrist for the contrast. You can also expect some lab orders, definitely a lipid panel, but probably a full-on everything, CBC, BNP, MAG, FOS, everything. So you're also probably going to be doing neurochecks every 4 hours, and we'll go over that very soon. And the other one that you're probably going to expect, depending on the patient's condition, you might have to do a bedside swallow screen just to see if that person can swallow safely. So let's just get back into that neurochecks. So at the hospital I work at, we use the MIND exam. The MIND exam is very comprehensive. It does take a little bit longer than some of the others, but you can catch a lot more. There's 12 steps to it. The first one is level of consciousness. You want to see how awake they are, how responsive they are. Do you have to, give them a little shake to wake them up? Or are they just opening their eyes to voice, etc.? The next one is speech. If they're awake, you want to ask them to repeat a simple sentence back to you, such as, "You can't teach an old dog new tricks." See if they can remember the words, see if they're mixing them up, or if they just can't even get that sentence out. Third, you want to ask them a question. Keep it simple. I usually go with, "What is your name?" to see if they respond appropriately. 4, you want to see if they respond to a command. Once again, keep it simple. Ask them to open and close their eyes. Whether or not they're actually able to open and close your eyes, it's irrelevant. You're not looking to see the motor function here. You just want to see if they understand what you're asking of them and try to do it. Next one is the facial droop. You just want to see if one side of the face is drooping, so ask them to smile. The next one is the visual fields. We all learned this in nursing school. You're gonna put your finger in front of their nose, about 18 inches, and you're gonna put it up to about forehead level and wiggle your fingers. Then you're gonna go down to chin level, wiggle your fingers again. You want to see if they can see it. They want to keep their eyes on you. You just want to see if they can see your fingers wiggle at all. The next one is also about gaze. Once again, finger in between you and the patient, and you're going to go from right to left. Once again, they need to keep their eyes on you. You just want to see if they can see your finger, and also if both of their eyes are tracking at the same time. So the next one is the motor arm drift. You're going to ask them to put their arms straight out in front of them and see if one arm starts going down or going out. Next one is the motor leg drift. Ask them to lift one leg in the air at a time and hold it there for 5 seconds. See if they can't do it or if it's tremoring. And the next one is sensory. Ask them to close their eyes. You're going to lightly touch them along their forearms and their hands. You're also going to go along their shins and the top of their feet and ask them, when do they feel something? If they can feel it in all 4 limbs, then it's good. If even one limb they can't feel it, that's abnormal. So the next one is the coordination. Once again, have them look at you. Put your finger in front of their face, about 18 inches away. Ask the patient to take their index finger, touch your finger, and then touch their nose. And do it a couple more times. And then you're going to switch. Same thing on the other side. You just want to see if they can find your finger and if they can find the tip of their nose. So the next one is also a coordination, but it's more for the legs. You're going to ask them to take their heel and run it down the shin of the opposite leg. You're going to ask them to do it from knee to foot. And you're going to have them do it on both sides. See if they can do it, appropriately and they're not struggling to do it. So that's how you complete a MIND exam. It is pretty extensive and it does take a little bit longer. So I would like to say here, if you are a first responder on a scene, please do not delay getting that person to the hospital so you can complete a MIND exam. If necessary, you can do the MIND exam on the way, but please get that patient to the hospital immediately. So our last topic is going to be stroke education. I know we all love education. It takes up a lot more of our time than we would like, but it is very, very important. So at the hospital I'm at, we have 2 different folders that we use. They're pre-made, and we have a blue one. It's for ischemic strokes and TIAs. And then we also have a red one. This one is for hemorrhagic strokes. I will say I have been on my unit for a year, and I have used this maybe twice. So for the purpose of this, we are going to be using the information in the blue one. So before we get started on that, I just want to remind everybody that this patient has now been through a traumatic experience. So you need to be sure of a lot of things before you go in that room and start teaching them. 1, you need to make sure that you have plenty of time to do this. There's a lot of information to cover, so please do not rush it. I know we all feel rushed, we have a lot to do, but please, for the sake of your patient safety, do not rush it. You also want to take into account the patient themselves. They have been through traumatic experience, they are probably tired, and they might have some neurological deficits. So keep that in mind. Are they having problems comprehending your words? Are they not really listening to you? Are they not remembering things? Lots of times I end up teaching their families more than the patients, just because the patient is so wiped out at that point, it's just not going to happen. But you also do want to still teach the patient as much as you can. So, once again, when you're teaching the family member too, they're exhausted too. Their loved one is now in the hospital. They have either definitely had a stroke or they think they might have had a stroke. So definitely be kind and just try not to push them too much. So you also want to keep in mind you need to tailor this education to the patient. These pre-made packets, there's a lot of information, and yeah, you do want the patient to know that, but definitely spend more time on what is actually relevant toward that patient. So let's see. So let's say I have a patient with an ischemic stroke. So this first part, it just covers if some medications that they might be put on or probably have already been put on. Probably going to be put on aspirin and Plavix. They might put on some warfarin. So, just go through, make sure you know what your patient is currently taking and what they will be taking in the future if you can. And definitely go into more detail about those medications. You want them to know the side effects and what to look for if something bad starts happening from taking that medicine. So, and here's what I'm talking about. There is a lot of information in these packets, so definitely tailor. Don't have to spend 2 hours in the room with a patient, but definitely be thorough. First part just talks about what could have happened to them. It talks basically what I told you earlier about the ischemic strokes and how that occurs. Then it talks about stroke diagnosis. This part I might kind of skim over with my patients, because more than likely by the time I get to them and get to this patient education, they've had a lot of this stuff done to them already. They've already had the CT, they've already had the MRI, they've already had the labs drawn and sent and everything. So I'll probably still go over it a little bit, but don't go too in depth. And talks about warning signs. I definitely like to go over this with my patients, because once you've had a stroke, you are more likely to have one again in the future. So the patient and their loved ones need to know what could happen again and need to know what to look for. Then, this is my other favorite part that I always go over, risk factors. You'd be amazed at how many people do not know the risk factors. They don't know that, oh no, you do have to take your blood pressure medicine. You do have to eat right. You do have to exercise. So you definitely want to impress on your patients how important all this is. They need to take their medication as prescribed. They need to get some physical activity. I realize after a stroke, there might be some deficits. They might not be able to move one side more than the other, but there's still some stuff they can do. And definitely diet. Make sure that you tell them that, if they're not eating right, they need to make some changes. Tell them that there is a dietitian, assuming your facility has one, that there is a dietitian that can come and talk to them about what changes they can make and what they really should be starting to eat and everything. So, and it's my other favorite thing. I have a lot of favorite things in this. This is our risk card for strokes. As you can see, it just has all of these little check boxes that you do, and you just go through and check whichever one you fall into. There's blood pressure, age, whether or not you smoke, how much exercise you get. So then once they've done it, you want to be in this little column right here. This is low risk. Middle one, yeah, you're getting up there. You might possibly have one. Red one, red is always bad. Red is always stop. That means you are at a higher risk for a stroke. I definitely not only tell this to my patients, but definitely to their loved ones, because they need to be aware too. And hopefully, unfortunately, though their loved one has gone through this, hopefully they will realize that if they have some bad things in their life, hopefully they can make a change too. And just give some more information. Some lifestyle changes. All right. High blood pressure. We live in America. We love our sugar, we love our salt, we love our butter, we love our fried foods. So, an astounding number of people in America have high blood pressure. High blood pressure is the #1 risk factor for a stroke. So, if you do have diagnosed high blood pressure, you need to be controlling it. Once again, that falls into taking your medication properly, eating right, getting some exercise. And make sure you tell your patients this. And hopefully now that this has happened to them, hopefully they start making some changes in their life. And it just goes on and on and on. Like I said, there is a lot of information in here. But I've been talking for about 2 minutes now about this, and I've already covered half of it. Granted, this is going much faster because I don't actually have a patient in front of me and I'm not taking their case into consideration. I don't know what medicine they're on. I don't know what their lifestyle is like. But you need to be thorough. You need to tell these patients what they can change, what they can't change, how they can change it. And definitely they need to take their medication. And you need to impress how important it is to do this. Because, like I said earlier, once you've had a stroke, you are more likely to have a stroke again. I know we love our patients and we don't want to scare them, and I don't either. I always want my patients to be smiling. But you can't coddle your patients. They need to know, and there is a way to do it without making them burst into tears. Just be kind, be gentle, but be firm. Make sure that they understand what you are telling them. Ask them to repeat information back to you. It's the best way I've learned. So usually when I'm going through this packet, I'll stop every now and then and be like, well, did you understand this? Well, what is this? Did you remember what I told you about this? I just like to, just keep rechecking, see if they're actually retaining this information. Because like I said, they're tired. They've just had a horrible, horrible thing happen to them. And the last thing they want is some whoever blabbering on about this. So, just keep smiling, keep talking. Don't talk forever, don't talk their ears off, don't make them exhausted, don't make them hate you. But it can be done, and it needs to be done. I'm amazed at how many of my patients have told me, oh, I experienced, some of these symptoms before. But they never went to the hospital because they didn't know. They didn't know the importance of this. So you need to impress on your patients, even if they're not a stroke patient. If these symptoms occur, they need to get help. So that's about it. I hope you all learned something, and I will see you later.